It's hard to believe there are still places in the world without the imprint of civilization. For those in the Sepik region of Papua New Guinea, the availability of life-saving medical care is nearly impossible, except for one amphibious airplane.
So we're here at Timbunki on the Sepik River. There's a snake bite patient. She was bitten by a snake yesterday afternoon and is showing signs. Her tongue is swelling and she's having a hard time breathing and semi-conscious, so we're going to get her some anti-venom and hopefully save her life.
This is just one of hundreds of life-saving stories. But over 500,000 people remain without access or hope for medical emergencies that could result in death. This is Samaritan Aviation.
Samaritan Aviation was started in 2000. And it began with a dream of myself and a friend who came over to Papua New Guinea. And while we were living on the islands, we saw a need for spiritual and for medical help and to bring the love of Christ to the people on the islands and also to the very remote areas.
For most of the 30,000 square miles of treacherous jungle, there are no roads. When Samaritan Aviation introduced the country's only float plane, it transformed the availability of health care in the region with the capacity to reach over 700 miles of river in this nearly inaccessible area.
We have one hospital in this area for 500,000 people, and 80% of them are anywhere from 3 to 5 days away. That's where the float plane comes in.
Operating as the only viable rescue aircraft in the province brings revolutionary medical care to the extremely rural villages.
And we're able to service 37 aid posts and clinics along the Sepik River and basically provide access and hope.
Delivering medicines, vaccines, and supplies to the remote aid posts provide treatment for deadly diseases like malaria and tuberculosis, as well as prevention of pediatric ailments such as parasites and measles. Samaritan Aviation offers these services at no cost to the tribal people, who have little to no means of accessing help. Maternal and infant mortality rates are among the highest in the Asian Pacific region, and the ability to reach medical care via a 1-hour flight rather than days in a canoe is truly life-changing. For Samaritan Aviation, it allows for meaningful relationships to develop as they actively reveal the love of God to the villagers.
And so for us, it's about spending time with the locals, getting to know them, who they are, and really just pouring into them.
The mission of Samaritan Aviation is to serve both the physical and spiritual needs of the New Guinea people, with a focus on community development.
Fulfilling the call, which is to empower the Papua New Guineans, really just to give them the tools that they need to be successful and to share Christ successfully here.
The established reputation of service in the region has allowed for unlimited opportunities towards real and lasting change, where individuals become followers of Jesus and communities are lifted out of cycles of poverty and disease through the integration of community development, evangelism, and discipleship.
Training them to then train other villagers, and that's the kind of things that excites me, to be able to hopefully be in 50 villages in the next 5 years and to be transforming communities. That's really what Samaritan Aviation has been called to do. And we have a tool, a float plane. It's so awesome that we can be the hands and feet of Samaritan, but you know, we can't do that without continued support from you.
Because you save lives. You save one life, you are saving the nation.
And so I just want to say thanks and also say please, continue to support us.